What's up everyone, my name is Christine and I have common variable immune deficiency. In today's video, I'm going to talk about what somebody can expect when getting their first IVIG treatment. I've made a video in the past talking about the overall treatment for CVID of IVIG and sub-QIG and some of my personal experiences with the treatment, and I will link the video above. But today I'm going to just talk about what to expect when getting your first IVIG treatment in a hospital or in a doctor's office. I will give the warning of this video that this is just a generalization. Obviously, with common variable immune deficiency, there is no cookie cutter treatment. So you may not experience everything that I state in this video. Everyone is different, and ultimately it's between you and your doctor with what you should do treatment-wise. But this is just kind of an overgeneralization of what to expect when getting your first IVIG. Because I know when I got my first IVIG, I was really scared, and there was a lot that I just did not know. As far as I'm aware, and unless things have changed, when most people start with immune globulin replacement therapy, they usually get a dose of IVIG first, even if they plan on doing sub-Q. Now, I have heard of some patients that get a very large dose of sub-Q initially, or they get the dose that they're going to be doing but several days back to back initially to get that loader dose. As far as I'm aware, that is less common. Perhaps it is becoming more common today. I'm not really sure. There are a few people that do just go straight to sub-Q, but from what I remember, a lot of people do get at least one dose of IVIG. Why do you have to get your first dose of IVIG in a center, and why can't you just start at home? Well, the biggest reason is that if you have a reaction to your medication, you want to be in a supervised center and you want to be around people that can handle such a reaction. Because it is a blood product, there is a risk of going into anaphylactic shock, and you want to just make sure you have the appropriate personnel around you that can treat the situation. Don't panic though. This is not a common occurrence, but it is protocol, and you'd rather be safe than sorry. And like I said in my video where I talk about my experiences, I had to actually switch brands at one point, and I was not able to be supervised in a doctor's office or in a hospital because I was away at college. And when I switched brands, I stopped breathing in the middle of the treatment. My airways closed, and it was really frightening. So that is why you have to first go into a hospital or a doctor's office. What can you do beforehand when going in for your first IVIG treatment? One of the most important things to do is to drink a lot of water. You want to be very hydrated. Today when I do my subcutaneous infusions, I do prefer Gatorade over water, but that is just a preference. Water is probably the best choice, but either way, you do want to be very hydrated. I remember when I was in high school and I had to do my IVIG, my classmates would always make fun of me because I'd have all these water bottles lined up on my desk, and my teachers were kind of annoyed because I was always having to walk out of class to go to the bathroom. But you are going to want to drink a lot of water. You're going to be peeing a lot. It is what it is. When you get to the hospital or your doctor's office, the infusion clinic, you're going to just check in like normal. They'll probably ask you some background questions, kind of like a standard doctor's visit or anytime you go to the hospital to get a procedure or something done. They'll probably take your weight, take your temperature, and take your vitals before you even get started. Once it's time to start the infusion, you will go back to wherever you're going to get situated, and the nurse is going to start an IV line on you. It is just a regular IV, a peripheral IV. There's nothing special, nothing to be worried about. Some people are harder sticks than others. I have small veins, rolling veins. I don't know. I don't have the best of veins. People did not enjoy sticking my veins. Hopefully you have better veins than I do. But that is another reason why you want to be very hydrated before your infusion, because the more hydration you have, the bigger your veins will be and the easier access the nurse will have to start an IV line on you. What they might do when they first put the catheter in your arm before they hook up the IV is take a syringe and draw blood. This is to do labs, and this avoids any extra sticks because you've already got stuck for the IV. They can draw the labs right beforehand, so you don't have to get another blood drawn done. Obviously, they need to draw the blood before they start putting any medicine in the line. Your doctor may or may not order pre-medications that can be given prior or along with your infusion. Common pre-medications include Tylenol, Benadryl, or some type of corticosteroid. The Benadryl and the steroid would be to help decrease any inflammatory reaction that your body may have to the immune globulin. Immune globulin is a blood product, and your body might have some type of inflammatory response to the medication. You might also be given a bag of saline to run along with your infusion to help with the hydration. When I had my first IVIG, I do not believe that I was given a bag of saline, but then again, this was over a decade ago, so I can't give 100% accuracy with that. But if I recall correctly, I had my first dose, but because I had side effects, nothing terrible, but I had side effects, my doctor after that went ahead and ordered a bag of saline with every IVIG treatment after that. During the infusion, your blood pressure and your pulse will be monitored periodically. It might be every 30 minutes, every 60 minutes. Probably it really just depends on the facility protocol as to how often they are going to be monitoring you. And during the infusion, you can just sit back, relax. You might have a TV that you can watch. Otherwise, you can probably bring your laptop or your iPad, you can bring a book, you can take a nap. How nice is it today that most medical centers probably have Wi-Fi? When I got my infusion over a decade ago, having Wi-Fi was not really heard of, and people didn't really have iPhones back then, and there was not an iPad in existence yet, so it would have been nice to have that entertainment at hand back when I had my first infusion. But it is really wonderful that that exists as an option for people today. But I recommend just sit back, relax, let the infusion go. You really should not feel anything during the infusion. If you feel anything abnormal, definitely let the nurse know so that they can address it. Remember, having a serious adverse reaction is really not a common event. After your infusion, the nurse will take out the IV line. You should be good to go. Some people will experience reactions to IVIG. Some people will have some side effects like muscle aches or flu-like symptoms. Any side effects or concerns should have been addressed by your doctor. I know my doctor kept me very informed as to common side effects that I may be experiencing. Obviously, if you have any questions, contact your doctor, contact the infusion facility. Let your nurse know if you're having side effects before you even leave the facility. Afterwards, you should be good to drive. The only exception I can think of, if you were given something like Benadryl, because Benadryl can put some people to sleep. With me, I know it can kind of put me into a coma. So if you're getting Benadryl, you probably want somebody else with you to drive you home. And I would probably recommend, if you could make it happen on your first infusion, maybe just have another driver until you kind of know how you react and respond to the infusions. Anyways, that is it for this video. I hope somebody out there found it helpful. I hope it can calm some nerves for somebody who is experiencing IVIG for the first time. And I know it is so overwhelming being diagnosed with this illness and getting this treatment, and there are a lot of questions, so I really just hope that somebody out there found this helpful. I wish you the best of luck with your first infusion, and congratulations to finally being on the road to feeling much, much, much better. Bye!